You want straighter teeth, but you don't want big metal braces getting in the way of your life, right? Well, take a look at Invisalign Teen, the clear alternative to braces.
I'm very into sports. I play soccer. I'm thinking about playing lacrosse this year. I play some guitar. I like musical instruments, and I love to go to school and hang out with my friends. I had braces before. I had Invisalign Teen, and I got a retainer, but I never wore it, and it kept falling out. It didn't clip onto your teeth. And Invisalign Teen really helped because it always stays in there and never falls out unless you want to take it out. Like, I wanted a straighter smile, straighter teeth, and I told my dad, and that's why I wanted to go check out Invisalign. And for soccer, it helps. I don't have to worry about getting hit in the face with a ball and hurting myself, or like at picture day at school, I don't have to smile with like a brace full of metal, and it's real convenient. I don't have to hide anything. And when I had braces, I walked into school the first day I got them, and everyone was like, oh, you have braces, what color bands do you have? Does it bother you? What does it feel like? But with Invisalign, it's just, nobody noticed it. I walked into school, people didn't know I had Invisalign for about like 2 weeks. Sometimes when I look in the mirror, I don't even know I'm wearing it.
Well, I've been wearing Invisalign Teen for a little bit over 2 months now, and I love it. I can definitely just be natural when I'm wearing my Invisalign Teen. It's just part of me. I don't have to worry about, oh, look at those clunky things in their mouth or anything like that. It's perfect. I don't even notice that I have my Invisalign in. The Invisalign, it's just a simple tray. You pop it in, when you eat, you pop it out, and that's it. I actually had braces before, but I did not wear my retainers. So I lost all the work that I had done, and I got Invisalign Teen. And I'm so glad I got Invisalign Teen to redo the work that I messed up, because it's so much easier. I'm definitely a smiler, and I definitely talk a lot, and it doesn't mess up my speech at all.
Invisalign Teen is clear, comfortable, and removable. You can live your busy life and straighten your teeth at the same time.
I do track in the spring, and I do long jump, triple jump, and the 100. And I love track, and then after school sometimes I have to work, and then usually with my spare time I hang out with my friends and just stuff like that. At first, when I got Invisalign Teen, I was a little afraid that it would impair my speech a little bit, like if I would just talk a little differently, but it really didn't, because they fit so well that I don't really have to worry about it now, because it just works well with my teeth. It works so well for me because no one could tell that I had them in, and since I have gaps in my teeth, they fit fake teeth into them, and with normal braces they couldn't do that. They would just everyone would be able to see them, but now no one can even tell. They look just like normal teeth, and my Invisalign just looks like I have no braces in it at all. What I like most about Invisalign Teen is they're clear, they're comfortable. I can never tell that I'm wearing them because they're so comfortable, and they're easy to keep clean.
Invisalign Teen, they have sensors on the side, so if I don't wear them enough, that my mom and my orthodontist will know that I'm not wearing them, and they'll tell me to wear them more, which is good because I want to get my teeth straightened. You don't feel them, you don't have to worry about sports or doing things, and you just take them out when you eat and put them in, and they're really easy to sleep in. And I like Invisalign Teen because you don't really have to worry about brushing them inside your mouth. You can take them out, and it's easier to clean and brush your teeth and eat.
All you have to do is take out the Invisalign Teen trays when you eat or drink anything besides water. Brush them when you brush your teeth, then put them back in, and you're straightening your teeth again. It's that simple. Even professionals, like Maddie, wear Invisalign Teen in front of the camera and during live performances.
Well, primarily I'm a singer and guitar player. I'm out doing gigs and performances every weekend and at different places around Pittsburgh. And also when I'm not singing, I host a TV show for the Pittsburgh Steelers, which is a lot of fun. When I'm on camera, I do wear my Invisalign teen. Being a singer, it was crucial for me to be able to take my braces out when I sing because it always distorted my voice a little bit when I had braces before. The Invisalign teen is a lot easier to take care of and manage than regular braces are. When I'm about to go on camera, I don't have to take a little tool in the bathroom and try to make sure my teeth are clear. I just have to take out the aligners, brush them, or put them in the little cleaner thing and put them back in, and I'm good to go. It's very convenient. My friends with the traditional braces are pretty jealous of the Invisalign teen because they're using their little tools to try to get stuff out of their braces, and I just take out my aligners and wash them. If somebody was considering to get Invisalign teen, I would tell them definitely do it. It's one of the best choices you'll ever make. I'm so happy with my Invisalign teen aligners, I can't even tell you. So I'm always smiling and I'm always meeting new people and talking, and it's made me a lot more confident. I think it's good to correct my teeth now instead of waiting until later because life's only going to get busier for me. So getting it done now is the best thing that I could do.
From day one, Invisalign teen is hard at work, and your teeth get a little straighter every day. And no matter what you're doing, Invisalign teen never slows you down.
I like to play sports a lot. I play volleyball, I play soccer, I play guitar in my free time. I really enjoy that. I've been playing that for about 6 years now. I'm allowed to wear Invisalign teen whenever I'm doing any of my activities. I wear them at night, and then when I get up in the morning, I always clean them out, and then I can eat my breakfast and put it back in. And before lunch, I just take them out and eat my lunch. You know, I usually rinse them out just to keep them kind of clean, but then I can put it back in, and it's really easy. Nobody really notices that I'm wearing the Invisalign teen. My sister got braces, and it took her like 2 hours to get the braces in. I mean, on my first time here at the office, it was only about half an hour, and I had my Invisalign in, and they're working their magic. I'm a smiley guy, I guess. I'm smiling a lot, but the Invisalign braces don't inhibit my smiling.
The treatment is easy to fit into a teen's busy lifestyle, and it's easy to keep your treatment on track. All you need to do is trade out your Invisalign teen aligners for a new set about every 2 weeks. Your doctor will tell you the exact schedule.
I had crooked teeth and I was sick of it. Everybody around me had already gone through braces, and so I wanted braces now, but I didn't want to have the big metal things in my mouth for senior pictures, junior pictures. I'm an upperclassman now. I shouldn't have to worry about metal in my mouth. So I want to go with something that was the translucent, like what Invisalign is. And I badgered my dad about it for 2 months straight, every single day. Get me Invisalign, Dad. 2 or 3 of my friends are worrying about their teeth right now, and they want it to be perfect for college and all these different opportunities that they're having. They're so conscious about their teeth. So I'm all like, go for Invisalign. That's the way to go. Invisalign teen, all the way. It doesn't disrupt your speech or playing an instrument or anything. Anything, even if you're playing something with a reed, which is really hard if you have regular braces. It's way easier with Invisalign teen. So much easier. It's major confidence boost to know that you're going to have perfect teeth and nobody notices while you're fixing them. It's great. I love it. It feels great to smile. Everybody loves to smile. It makes me happy.
I'm a sophomore in high school. I play softball all year round. I play the piano. I like to shop. That's about it. I was kind of afraid of braces. Truthfully, I couldn't imagine having braces. I was afraid of metal, the pain. They gave us many options, but we were kind of set on Invisalign. Invisalign teen fits into my schedule because it's I clean it in the morning when I wake up, and it's easier for me to brush my teeth, and my teeth feel a lot cleaner because I get to brush them when I'm done eating, and no one knows they're in there, so I don't have to worry about hiding my smile. I can just let loose and have fun all day. My favorite part about Invisalign teen is that I can take them off and brush my teeth. My teeth can always feel clean. The earlier you get it, the more you have your life to live with straighter teeth. I would definitely recommend Invisalign.
Most people will never notice that you're wearing Invisalign Teen, and if you should happen to mention it, don't be surprised if they want to get it too.
I've been wearing the Invisalign Teens for about 6 weeks now, and I really like it so far. None of my friends, I didn't tell anybody that I was getting them, so the only time when people see it is if they're really up close to me, and they're like, oh my gosh, you have braces. I'm like, yeah, and I really like it. And it's really closing up my gap too, so a lot of my friends are like, oh, I really want Invisalign Teen now, because you just can't notice them, and that's just a really big plus about having an Invisalign Teen. The only time I take them out is to eat, but I put them right back in and wear them to bed at night. This year for my school pictures, I wore in the Invisalign Teen, and it was a lot better than my last year's pictures because you can't see the gap.
Invisalign Teen fits perfectly into your lifestyle. That's why more and more teens are making the clear choice to straighten their teeth and get a better smile.
I am on a forensics and debate team. I'm into acting too, and I really like on the stage they're not glaring or anything like the other braces. You can't see them, and that's what I like about them too, because nobody can know that you have them in. They are so clear, they're easy to clean, they're not as much work as the other braces where you have to make sure that you don't get something in them, or you have to do all this weird stuff with the water pick. It's basically you brush your teeth and then you clean the aligners and you pop them back in and you're done.
And parents love Invisalign Teen because it's so easy for their kids to brush and floss the right way.
They can take such better care of their teeth by being able to take the Invisalign out and really take care of them. Never have we had an issue with compliance with the girls. It has not affected their lifestyle one bit. Our oldest daughter, Caitlin, she would wear the Invisalign for photos, even when she didn't have to be wearing them anymore, because she said that they made her teeth look shinier, prettier. Gracie, the youngest daughter, wasn't going to need to wear braces. And she took a fall from her horse and shattered her jaw and lost a tooth in the bottom. They were actually able, where she lost the tooth, they paint in this wonderful tooth-colored material, so you can't even tell she's missing a tooth now, and I love that. I think that's great. We're excited to see Gracie's teeth in 11.5 months.
I have had the Invisalign for just over 2 weeks, and I've already noticed a difference in the straightness of my teeth and any problems that needed corrected. It's already starting to shift them where they need to be. Every second they're getting a little bit straighter. I can wear Invisalign Teen as I'm riding my horse and in everyday life. It doesn't impair anybody's speech. It's comfortable. I don't even realize that they're in most of the time, and it's great. I mean, they really are invisible, so you can't even tell, and you can still go about your daily life and not worry about how they look. So a lot of my friends have the traditional braces, and when they saw the Invisalign, at first they didn't even notice that I had them in, and they were really excited for me.
Your smile is a big part of who you are, and it's important to do everything you can to help make your teeth as straight and healthy looking as they can possibly be. Invisalign Teen is the clear alternative to braces, and it fits into your busy life beautifully. Invisalign Teen. It fits you, it fits your lifestyle. Ask your doctor about it today.
I love my smile now.
It's crazy. It definitely allows you to be more you. Lets you smile more.
It's great. I love Invisalign Teen.
I really just love them.
Honey, you stopped breathing again. I'm really worried. I think you should go see the doctor.
Obstructive sleep apnea, or OSA, can cause people to stop breathing for 10 to 30 seconds, sometimes for a minute or more, hundreds of times per night. Dentists who are trained in dental sleep medicine can provide an alternate therapy for snoring and sleep apnea using oral appliances. After being diagnosed, your sleep physician will discuss therapy options, including oral appliance therapy, CPAP, and surgery. People can stop breathing when the upper airway collapses, causing events of sleep apnea. Reduced airflow to the lungs results in lower oxygen levels in the bloodstream, affecting the brain, heart, and other vital organs, and can be life-threatening. Other signs of OSA may include frequent or loud snoring, choking or gasping. Left untreated, OSA can cause excessive daytime sleepiness and increase the chance for work and motor vehicle crashes. It also raises the risk for high blood pressure, heart attack, stroke, diabetes, obesity, depression, cognitive problems, as well as sudden death during sleep. Sleep apnea may be diagnosed at a sleep center by a sleep physician. Continuous positive airway pressure, or CPAP, is a standard treatment. CPAP provides a steady stream of air through a mask that balloons the airway open. While therapeutic for most patients in the sleep lab, many people cannot tolerate CPAP and do not use it every night at home as prescribed. Oral appliances used to treat sleep apnea look like sports mouth guards and are worn while asleep. These devices shift the lower jaw and tongue forward to open the airway. First, your dentist will review your responses to health questionnaires and take a medical and sleep history. Your dentist will examine your mouth, jaw joint, airway, and any necessary imaging such as X-rays. You will learn about oral appliance options, including benefits and possible side effects. After reading and signing an informed consent form, you may choose to proceed with oral appliance therapy. Your dentist will take impressions of your upper and lower jaws and may also take a record of a starting jaw position to optimize treatment success. He or she may use photographs to help monitor progress. Models of your teeth and the bite registration will be sent to a dental lab where the appliance will be made. A few weeks later, you will return to the office to be fitted with your custom-made oral appliance. The appliance will be adjusted to make sure it is comfortable. You will learn about cleaning and maintaining your appliance and any indicated adjustments. Then your sleep physician may perform a follow-up sleep study to confirm that the device improves your condition. You and your dentist will adjust the appliances necessary to reduce the snoring and sleep apnea symptoms. Several more follow-up visits may be necessary to ensure the appliance is working properly and that you are comfortable using it. The American Academy of Sleep Medicine's practice parameters recommend oral appliance therapy as a first-line treatment for mild to moderate OSA. Oral appliances are also recommended for severe sleep apnea patients who cannot tolerate or comply with CPAP. To find a dentist trained in oral appliance therapy, contact the American Academy of Dental Sleep Medicine at www.aadsm.org or call 630-737-9705. This video includes actors, but the dentist is a real dentist trained in oral appliance therapy.